It's 11 p.m. The house is quiet. An elderly man lies in bed, finally drifting toward sleep, when suddenly, his heart slams against his chest like a fist pounding on a door from the inside. It races. It flutters. It feels like it might burst out of him. He sits up, gasping, hand pressed to his chest, heart thudding at what feels like 200 beats a minute. Fear floods his body faster than the blood through his veins. What is happening to him? This moment, a sudden, racing heartbeat at night, is far more common in elderly people than most of us realize. And tonight, we're going to walk through exactly what's behind it. Gently. Scientifically. Honestly. To understand this, we first need to understand something beautiful about the human heart. It doesn't just beat, it listens. It listens to chemical signals, nerve impulses, oxygen levels, even the rhythm of our breathing. In a young, healthy heart, this listening is calm and steady, almost effortless. But as we age, the heart's electrical wiring, the delicate pathways that tell each chamber exactly when to contract, begins to wear down, much like old wiring inside the walls of a house that has stood for 80 years. Most of the time, this wear is silent. It causes no trouble during the busy hours of the day. But at night, the body shifts into a different mode entirely, and that's precisely when these hidden vulnerabilities can suddenly speak up. Here is what changes when the lights go out. When we lie down to sleep, the nervous system shifts control from the sympathetic system, the fight or flight alertness that drives us through the day, to the parasympathetic system, the one that governs rest, digestion, and stillness. Normally, this shift is gentle. The heart slows down. Blood pressure dips slightly. Breathing deepens. But in older adults, especially those carrying an underlying heart condition they may not even know about, this nightly transition isn't always smooth. The vagus nerve, the very nerve responsible for calming the heart at night, can sometimes overcorrect. In a heart with already fragile electrical pathways, that overcorrection can trigger sudden bursts of abnormal rhythm. The heart doesn't just slow down peacefully, it stumbles, races, and lurches forward instead. It's a bit like a car easing into a lower gear, only for the gearbox to slip and the engine to suddenly surge. There is something else happening in the body at night that adds to this. Lying flat changes blood flow. More blood returns to the heart and lungs than when we're upright. For most people, this is harmless. But for an aging heart, that extra volume can stretch the heart's chambers just slightly, enough to irritate sensitive electrical tissue and spark an irregular rhythm out of nowhere. This is why so many elderly people describe these frightening episodes happening specifically in bed, specifically at night, in the very moments the world has gone still. So what is actually behind these sudden surges? The answer isn't one single villain hiding in the dark. It's usually a quiet convergence of forces, each one small on its own, but dangerous when they meet at the same moment, in the same fragile heart. The most common culprit carries a name many elderly people have heard whispered in doctors' offices: atrial fibrillation, or AFib. In AFib, the heart's upper chambers stop beating in one clean, organized rhythm and instead fire off rapid, chaotic electrical signals, dozens of tiny, uncoordinated impulses competing for control. AFib becomes dramatically more common with age, and it has a well-documented tendency to strike specifically at night, triggered by exactly the nervous system shift we just described. For many elderly people, an AFib episode feels precisely like the moment we opened with: a sudden flutter, a racing thud, the unmistakable sensation of the heart running away inside the chest. Another possible cause carries a different signature: paroxysmal supraventricular tachycardia, or PSVT. Think of it as a short circuit, an electrical loop inside the heart that suddenly fires the organ into a rapid, steady racing rhythm, sometimes well over 150 beats per minute. Unlike AFib's chaotic flutter, PSVT often feels like a switch flipping on instantly, holding steady, and then just as suddenly switching off, leaving the person breathless and shaken in the silence that follows. Sleep apnea plays a far bigger role in this story than most people realize. When breathing repeatedly pauses during sleep, sometimes dozens of times a night, oxygen levels in the blood quietly drop. The body, sensing danger, responds with a sudden jolt of stress hormones meant to force the airway back open. But that hormonal jolt doesn't politely knock on the throat alone, it slams into the heart too, triggering exactly the kind of sudden racing episode we've been describing. This is especially common in elderly men with a history of loud snoring or unexplained daytime exhaustion, even if sleep apnea has never been formally diagnosed. There are quieter, less dramatic causes too, the kind that build slowly in the background of daily life. Certain medications, particularly some prescribed for blood pressure, asthma, or thyroid conditions, can subtly sensitize the heart's electrical rhythm without anyone noticing for years. An underactive or overactive thyroid gland can do the same, nudging the heart toward instability. Low levels of potassium or magnesium, common in elderly people taking long-term diuretics, can destabilize the heart's electrical signaling at a cellular level, like loosening a single screw in a complex machine. And then there's the body's gut and nervous system working together in a way few people expect. Acid reflux, a full stomach before bed, or even simple dehydration can stimulate the vagus nerve through the digestive tract, sending an unexpected ripple straight to the heart. Anxiety, too, quiet, unspoken anxiety that surfaces only in the stillness of night, can elevate adrenaline just enough to spark the very racing it fears. In this way, the heart and the mind are never truly separate, one listens constantly to the other, even while we sleep. So here is the question that matters most. When should this be taken seriously, and when can a person breathe a little easier? A single, brief episode that resolves on its own, especially one tied to stress, dehydration, or a heavy late meal, is rarely an emergency by itself. But a pattern matters far more than any single night. If the racing heartbeat happens repeatedly, lasts more than a few minutes, comes with chest pain, dizziness, sudden weakness, shortness of breath, or fainting, this is the body sending a signal that should never be ignored. These symptoms deserve a real conversation with a doctor, not Google searches at 2 a.m., not silent worry carried alone until morning, but an actual evaluation, ideally with an EKG or a heart monitor that can catch the rhythm in the act. The good news, and it is real good news, is that most of these causes are manageable once identified. AFib can be controlled with medication or, in many cases, treated directly. Sleep apnea can be diagnosed and managed, often dramatically reducing nighttime heart episodes within weeks. Electrolyte imbalances can be corrected with simple blood tests and dietary adjustments. Even anxiety-driven episodes respond well to breathing techniques, routine, and reassurance once the underlying fear of "something is wrong with my heart" is properly addressed by a professional. What matters most, for any elderly person experiencing this, is not to carry the fear alone in the dark. The body is not betraying them, it is communicating with them, in the only language it has. A racing heart at night is frightening, yes, but it is also information. It is the heart asking for attention, for rest, for balance, sometimes for medical care, but always for compassion rather than panic. If someone you love, a parent, a grandparent, an elderly neighbor, has ever described this exact fear to you, share this with them tonight. Knowledge replaces panic with understanding, and understanding is the first step toward feeling safe in one's own body again. If this explanation helped you understand what's really happening inside an aging heart at night, like this video and leave a comment below sharing your own experience or your loved one's story. It might be exactly what someone else needs to read tonight. And if you know someone who needs to hear this, share it with them right now. It could be the gentle nudge that finally gets them to see a doctor.